Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, we're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.
Hey everybody, we're excited to be here with you today with Dr. Doug Wallen and Dr. Kelly Seeps. Doug, I have the pleasure of working down the hall with every day. He's a storied optometrist with dad jokes and funny puns and makes everybody smile every day. But make no mistake, he's a guy that understands his craft and his profession and deals with some of the most challenging refractive cataract problems that are out there. And Kelly Seeps is an absolute star. The first time you meet her, she works her way into your heart quickly, and you realize how competent and delightful and kind and good she is. She's in our Sioux City office, and we are so lucky to have her, extraordinarily well trained. And my name's John Berdahl. I'm one of the surgeons in Sioux Falls, and I do cataract, cornea, refractive, and glaucoma. And today we're talking about all things cataract surgery. We're going to talk about three main kind of topics. We're going to talk about what makes exceptional cataract surgery, how we do that at Vance Thompson Vision, and when is the right time to get cataract surgery. So with that, I'm going to start with a broad question. Hopefully we'll move into more specific questions and maybe even have a little bit of a controversy along the way if we can find one. I don't know if we will on this topic. But Doug, if there was one thing that you wanted a 65-year-old patient to know about cataract surgery, what would it be?
It would be, there's a lot of things, but the thing I would pick would be if you have cataracts and they're bothering your vision and you're struggling with how you function, your eye doctor tells you they can't really change your glasses to make it any better, and you're feeling this is the time for me to do cataract surgery, which that's our definition of it, then the thing I'd want to know is that when I'm going in to have my cataract evaluation and my cataract surgery, that I know all of my options. And what I mean by that is there's a number of different options of technology to use when you have cataract surgery done. And the fun thing about that is it's based upon what your goals and your dreams for the way you want to function after your cataract surgery. People out there talk to other people who've had cataract surgery because it's the most common surgery performed in the United States. And so they hear lots of people talking about how wonderful it is, but they really don't know the right question to ask is, what's the best technology for me? So when you're looking at cataract surgery, you need to be somewhere where they say, we have all the technology available. Let's find out what technology matches your eyes so that you get to reach your goals. That's what the number one thing I want them to know.
Great. Kelly, one thing,
I think,
65 years old.
yeah, I think I was taking your question in a little bit different direction. But what I would probably tell them is it's an opportunity to change your life for every year that you have left, because of all of these different options that we offer. And it's, especially for patients who've needed glasses for their entire life, as someone who's never needed glasses and hasn't, I know for a fact that I take it for granted. And so for those patients that come to us and don't wear glasses and want to continue that way or are in glasses all the time, cataract surgery is an opportunity to change their life. And yeah, I think the sooner the better. So
if I had to say one thing, mine would be ask your doctor this question. What would you do if you were me? And that is whether or not having cataract surgery, and number two, which lenses would to use. And that's how I would boil that one down. And then number two is, if I got a second one, I'd probably say, don't wait. It's just another year that you're not going to be seeing as good as you can, and kind of in the back of your mind worrying that you're going to have eye surgery in a year. And cataract surgery is pretty straightforward. Well, let's dive into, what makes exceptional cataract surgery today? And we're going to try something where we go ping pong. So we'll see who can win between the two of you on who can come up with what makes high quality cataract surgery. It's kind of like a joke off. You say a joke, I say a joke. But Kelly, actually, Doug, since you're much, much older, have
Yes.
you go first.
I'm gonna
And
lose. I'm gonna lose this ping pong match. I can tell you
okay,
that
sounds
right
good.
now.
Whoever can keep going wins.
Okay.
One sentence answers. What makes exceptional cataract surgery in 2025? One sentence answer. Doug,
Experienced surgeon.
Kelly,
Advanced diagnostic equipment.
Best
Doug.
patient experience on earth.
Clear explanations for expectations.
All available IOL options.
Um,
IOL meaning intraocular lenses, the implant we put in.
yeah. Clear patient communication. That's kind of like what I just said. So I don't know.
We'll give you credit. We'll give you credit. Keep going, Doug.
Uh, Option to do your follow-up and post-operative care with your family eye doctor that you've been with for years, or with us, or a combination thereof.
Option to fine tune your eyes further after cataract surgery.
Great. So it's in LASIK enhancement capabilities after surgery. Doug,
Greatest and nicest front desk personnel on the planet.
Kelly,
Yeah. Greatest and nicest technician to run your testing.
Great. Option of having back-to-back surgery, cataract surgery, back-to-back days.
So just to clarify that one, I can have my first eye on Monday, second eye on Tuesday.
Correct.
Got it. Kelly.
Yeah, option to have your evaluation on the same day as your first cataract surgery.
Oh, this is getting fun. We're digging deep here. Doug?
Cataract surgery without an IV, numbing drop only. They give you a little gel tab they put under your tongue. They tell you it's lemon flavored. It's not. It doesn't taste very good, but it does a great job of making it so that you're awake and aware, but most of the time you don't remember it, which people love.
Kelly.
I would say easy post-operative care or instructions. So, for example, only needing 1 drop a day after cataract surgery.
I can
Oh,
tell
you
you
took
guys
my one
both
drop a
want to
day.
win.
I didn't know you were gonna go there. That's double. You included 2
Yep,
there.
yep. And the judge rules it's fair, Doug.
That judge rules it's fair. Then I would go to the option of having an enhancement or a fine tune afterwards, especially when you have an advanced implant lens and we don't quite hit the target or not quite happy. We have the option to come back and do a LASIK or laser touch up or fine tune to dial your vision in great.
And Kelly wins because Kelly said that earlier.
Oh, she did. Oh, dang
So
it.
great job, guys. And Doug, just to be fair, I knew Kelly was going to win no matter what. I was super biased
Yes.
towards it, but indeed. Okay, so there's a lot, so cataract surgery doesn't take that long. And everything that you guys said is true. And I always try to force people into what's most important and all that kind of stuff because I think it helps us think. But the reality is dozens of things need to come together to have world-class virtuoso cataract surgery. And so just to try and put that in a start to finish from a patient or referring doctor perspective, you want to have an ability to have your appointment right away. Get in within a couple of weeks. Have your surgery within a couple of weeks. Have people explain to you what the process is going to be like and give you information along the way. For example, you'd get a video of your surgeons and your doctors talking about your lens options so you're ready to make a decision. You show up for your day of surgery. We're actually happy that you showed up and didn't wish that you didn't show up because we run a nice patient friendly experience. Technicians that know what they're talking about, that explain to you the tests they're taking. Doctors that not only seem like they care, but actually do care. And doctors that are competent. And then counselors that help you understand like what the financial impact is actually going to be to you. One of the biggest frustrations in healthcare is that there's like not prices for stuff. And you just go and have your thing and then just hold your breath until you get some big bill at the end. We try to make sure that people know what they understand, and then the ability to finish. And so maybe one more thing before that, convenient surgery, meaning you don't have to have an IV. You are going to get comfortable sedation. You don't have to put in this whole pile of drops. In fact, you don't even have to go to the pharmacy. We have them here for you. And then lastly, an ability to finish. And that is, critically important. Leaving the ball on the 3 yard line is not our goal. It's to get it into the end zone, and an excimer laser enhancement that's included with the price of surgery when you're doing premium IOLs is a big part of that. So let's transition a bit, just for a couple of minutes, into and I think that obviously that's what we believe and that's what we do. But Doug, how long have you been in practice, Doug?
I started in practice in 1991.
So
So
that's
that would be 34 years I've been.
Cal, you look good. Man, you look good, buddy. Um, so so let's just talk cataract specifically. What are
Yeah.
the biggest changes in about 30 seconds or less
Okay.
you've seen over the last 30 some years in
In
cataract?
cataract surgery, the couple with the surgery itself, small incision cataract surgery where the incisions heal themselves, huge. I mean, you guys are doing these surgeries in 5 to 8 minutes, and with incisions that seal themselves, and gives me the privilege of being able to see patients afterwards, post-operative, that heal so quickly. So the innovations within the surgery of that type of thing. The second is the technology improvement in implant lenses, or options that people have. No longer is it just a single power. You get multifocal implants. You can correct astigmatism. You can correct the vision so that people can function in a lot of what they do without glasses. That's the second thing. And then all the other stuff that we already mentioned, like the drop a day and the sedatives that we use and all of that, have made cataract surgery no longer a do one eye, wait 2 to 4 weeks to hope everything is healed fine before we do our other eye. So it's become so much more convenient. And that is the reason why people don't have to wait anymore. It's not a wait till they get ripe or wait until your vision's absolutely horrible. When it starts to bother you, it's time to do it, and don't wait. That was more
Kelly,
than 30 seconds, sorry.
that's okay. Kelly, you've been in practice for how long?
Just about 4 years now.
Okay, I was hoping you were going to say three, because we had 3.4
Well,
years
I've been
and
with
30.
Thompson
4 years.
for almost 3.
Sounds good. 3.4 years versus 34 years.
Yeah, and I
What?
was born in 1995, so after
Yeah.
Doug.
Yeah.
Got
Yeah. No,
it.
I used to think that was fun to say when I was young too.
I joined Vance on Valentine's Day of 1995. So
Aw.
that's
Okay. So Kelly, you've been in training recently.
Mhm.
And so maybe you've been in different places. How do Doug and I are old and we just worked in VTV for all of our careers, more or less. You're out of training. How does VTV do it different, since you've got a fresher perspective of that?
Yeah, that's a great question.
Thank you.
It's something that I kind of had to retrain myself when I came here, because where I was before, we still offered very similar things as far as lenses go. But there was very much a mindset about like, if we do, this multifocal lens, there's a possibility that the patient isn't going to be happy. And that takes up a lot of my time and chair time to make sure the patient gets to a point where they are successful and happy with their outcome. And so maybe I'm not going to explain how beneficial this lens can be. And so learning about all of the, like, being able to focus on all of the happy patients, and, because the only patients that need a fine tune, those are the patients that are coming back to see us, and the patients that are at that 3 yard line, and we have the opportunity to take them to the end zone. And so the patients who are happy, they don't come back to see us. And so I think it's easy to get focused on the patients that do take a little bit of extra time and love, but it doesn't mean that it's a bad lens or it was a bad option to begin with. It just means that we need to do a little extra work. And so the back-to-back surgery was new to me. It was only ever like you have the option to go a week apart. And then, yeah, I just don't think there's a lot more the patient experience portion of it, what we offer to patients as far as like making sure they feel supported and feel that VTV love. That's been something different for me as well. So.
Okay, so I'm going to try and summarize that. Um, uh, Doug, from your longitudinal perspective,
I
it
like
went
that
from
longitudinal.
cataract surgery techniques and smaller incisions, faster recovery times to better lenses to even better lenses to then focusing on the kind of patient surgical experience, let's say, where sedation and fewer drops and the timing of when we do surgery back to back has kind of been your evolution. And Kelly, I think that what I heard you say was three things. Number one, man, you guys will fight for it at VTV, the vision. You're not afraid to do the extra work to try and get somebody the vision that they hope for the rest of their life through a multifocal light adjustable lens, toric lens to fix astigmatism, get people out of glasses with cataract surgery. Number two, the kind of what Doug said, the structure of making it as convenient as possible to have surgery. And then the third is showing the love. And just like I hear all the time, I'm waiting for them to tell me how great I am. I don't hear that very often. What I hear all the time is, man, your team is so knowledgeable and they seem to really like their job and they answered every question that I had and then asked me if I had another one and I ran out. And so that's what I think is what we stand for. And we internally we talk about kind of three pillars. One, do the right thing. Two, a commitment to the world's best technology. And number three, a patient experience second to none. How I view that, and I think we view that, is patients might be able to sense if you're going to do the right thing, but maybe not. And as maybe there's even some erosion in the trust of doctors, there might even be some suspicion. But it's hard for a patient to tell that. They definitely can't tell what the best technology is. That's too, technical. But they can tell how they were treated. And it's pretty hard to fake authentically treating people well. And so all of that, I think, wraps up into those three things. And let's move into now, how long should I wait for my cataract surgery? So if you were to say and Doug, this time I think you're going to get it, in less than 30 seconds.
I will.
Okay. Doc, how do I know if I need to have my cataracts taken out?
When your vision isn't functioning the way you want it to in your life, and your eye doctor says, I can't change your glasses to make it any better, it's time to take cataract out.
Great. Kelly, how do you say that if your uncle asks you at the family reunion?
I just very similar. If you don't feel like you're seeing the way you want to see and you've noticed any decline in the overall quality of your vision, then it's time for cataract surgery.
Great. I like it.
I also tell patients, waiting longer, because part of this is eye surgery, and eye surgery for people is kind of creepy and very anxiety provoking, and so a lot of people hold off for it because they're a little bit afraid, so I tell them waiting longer doesn't decrease your risk. Doing it sooner doesn't increase your risk. It's the same no matter when you do it. So make the decision when it's bothering you, and you don't have to wait until you're, to the point where you're literally not functioning before you do this.
I love that.
Can I make one more comment too, back to
Yeah.
our last topic that we were talking about, because you were talking about the third part of the patient experience and being nice. I thought that was a really interesting comparison between me, who's been around forever, and Kelly, who's been here fairly recently, is that I focused on all of the things that we do surgically and all the nuts and bolts of what we do, because I've been I've been immersed in niceness for 30 years now, and it's when we have people who come in who are new who say, where did all this niceness come from? We don't have people that are I was thinking about this the other day too. We don't have people that we fire very often, because the people who leave, they leave because they can't stand all the niceness. And sometimes, and so we, it's the group that we have and the culture that we have is something that those of us who've been around for a long time say this is just our normal. This is the way, this is what we operate under all the time. So anything that's new, technology wise or with surgery wise, that's what we notice. And then the ones who are newer say, wow, I came from a place, I'm used to having the technology. It's just that I've never seen it delivered in such a wonderful fashion like this. So
Totally,
I thought it was
totally.
a great comparison.
Yep, indeed. And so, when if my uncle asked me, how do I know if I should get cataract surgery? Usually what I say is, do you ever not go out at night because you'd rather not drive at night? And try to give them something really specific. And, they're like, I'd maybe go to the VFW or get a pizza or something, but I'll just order in because I don't really love driving at night.
Right. Yeah.
And I'll ask people sometimes, does driving at night bug you? And they say no. And I say, do you ever drive at night? They say no. I say, how come? Because I don't like driving at night. I don't like how I see.
Yeah.
And I love people in the Midwest. They're just unwilling to complain. So let's talk about
Vance boils it down to even a simpler question. When people say, he says, how's your nighttime vision? Well, it's
Yeah.
not very good. You should have cataract surgery.
Yeah, no, I think I think
It's
that
almost
is
that close,
it cuts through all of it.
Yeah.
So we're going to ask why now? Why should I have my cataract surgery now? Well, number one, your vision's bugging you somehow. Maybe it's nighttime vision, usually is. Number one. Okay. So, but I just want to think about this for a few months. And I get it. I get it because somebody's going to have their hands in your eyeballs. And that seems scary. Okay. But here's the conversation that I have with that patient. You're going to have cataract surgery. You have a problem now. And honestly, the worst part of the whole experience is usually the anxiousness of waiting for it. And so now you took the worst part of the experience and prolonged it 3 months. Now, once in a while, there's a legitimate reason for that, right? We're going to be in Zimbabwe for a while or something. Usually we'd want to try and get it done before they go to Zimbabwe so they can enjoy their vision, but there may be a legitimate reason. But I feel like the biggest, negative health impact from cataract surgery is the nervousness and the anxiousness that so many people have. But let's talk about this a little bit more tangibly than that. Let's talk a little bit about the finances and getting it in before the end of the year and deductibles and copays and stuff like that. So how do you guys approach, and how does VTV approach trying to get people in before the end of the year when it starts to get crowded as people don't want to do it after they've met their deductible?
Yeah, what we do is we actually increase our schedule and increase both the surgeon schedule and our clinic schedule so that we can fit people in sooner. Because people will delay it. They'll come in and they'll say, I'm really nervous about doing this. I don't think that I want to do it. And I said, well, but you took the first biggest step for that fear was that you scheduled the appointment for a cataract evaluation. So you're sitting here in front of me. So you've obviously got enough of an issue that got you past that fear to come in for the appointment. And now that you're here and know how much better this could make you, I think it's a great option for you to go forward. But we have those people who, we're getting ready to go south, or we're getting in before the end of the year because we've got our deductibles with our insurance. And the nice thing is we load up our schedules so that we make room for those people. So we not only can get people in very, very quick anyway, but toward the end of the year, the last 4 months of the year, we get them in really quick if we have to. And that's the nice ability that we have. And then those people can feel comfortable that I can get this done before we head south or before the end of the year. So it's in before my deductible happens. But we also don't put you under any pressure. I tell people all the time, you can think about this, whether you're going to do the standard or traditional cataract surgery and you're okay with wearing glasses afterwards. Those are some of our happiest patients. And it's actually the majority of what we do. Or whether you're going to go with an advanced implant and make it so you're not dependent upon glasses. for most of what you do in your life, you have the chance to make that decision, and we'll hold your hand and help you through that so that you make the best decision for what's going to be the vision you have for the rest of your life.
So we got about 2 minutes left. Kelly, what are your thoughts? How do you think about um, trying to get it in before the end of the year? How much time do I have to wait? And how long till I get back to my regular activities?
Yeah, so it is that common misconception of like, well, are my cataracts ready? I always tell my patient, it's not your cataracts that have to be ready, it's you that has to be ready. But you can financially make it work a little bit better for you. You know, that's the beauty of an elective procedure is it can be done at any time that you are ready. But if you do it once your deductible has been met before it kicks back in at the first of the year, that's a way to kind of be a little financially smarter about it. If you have any FSA dollars that are saved up, FSA usually is a use it or lose it fund. And so those can't be used usually after the first of the year. HSA typically does roll over, but those can be applied to cataract surgery and elective procedures as well. So usually, depending on how your surgery is set up, you know, like we said, we get you in as soon as we can. We get your surgeries done as soon as we can. And typically people are seeing better the day after cataract surgery, and then they're back to their normal activities 1 week after surgery. And so if you do have that vacation coming up, you know, you should be good to go. And there's no restrictions in flying to that vacation. There's no time to wait as far as that goes. And so if you're seeing well at day one and you're able to resume all normal activities by week one, then, and it works in your schedule, then we say, yeah, whenever you're ready, let's go for it.
So I'm
I
going to give you
love
all.
learning new cool things to say from young doctors. What you said
Yeah,
at the beginning, your
yeah,
cataract doesn't have to be ready. You have to be ready. I love it.
that's great.
Thank you,
So
Kelly.
I'll give you guys each the a parting thought here in a second, and here's mine, which is cataract surgery is one of the most successful surgeries in all of medicine with some of the best technologies in all of medicine, especially the lens options. And so, what we really want to understand is how do you want to use your eyes for the rest of your life? Match the right technology to the right patient. Make sure we give you clear guidance on what we would do if it was our eye. And you make sure you ask us or your doctor, whoever that is, that question. And, rest assured that cataract surgery isn't quite as scary as you think that it is. And if you're fighting through vision you don't really love, start loving your vision again. Uh, Doug will give Kelly the last word. So give us your parting thought.
My parting thought is don't wait. Don't be afraid to come in for the evaluation just to see where you're at and know what your options are. If that means you want to wait a little bit or we determine that you're okay for a while, that's great. I have people who come back over several years before they make the decision that I'm ready now. And but don't be afraid. Just take the first step, come in for the evaluation so you know where you're at, and then you can make your decision going forward, really knowing what's available for you. So take that first step. It's important.
Kelly, bring us home.
Yeah, I think when you're even considering pursuing surgery, ask your optometrist, ask your friends, if I were you, where would you go? If you were me, where would you go get surgery? Look up reviews on Google. I think even AI right now can give you a summary of, different surgery centers just to get a good idea of, what there is to offer if you're maybe not in an area where VTV is located, but you're still interested in cataract surgery. Just ask people that you trust where they would go. And yeah, I think whenever you're ready, there's no time to wait, and we'd be happy to help whenever.
Yeah, I think I'm going to underline what you said. Uh, Ask your eye doctor. Your eye doctor may want to give you a number of options, and we want to give them options. But just like you need to ask your surgeon, what would you do if it was your eye? You need to ask your optometrist, where would you go if it was your eye? And they'll tell you the truth. And then go there. Wherever that may be, go there. So with that, thank you guys. Great job. Kelly, the new queen of the head-to-head technology challenge that we had here. And Doug, it's probably just because you and I are getting a step slower, and this
That's
young
right.
spry generation is
Reaction speed's just slightly down.
not
Yeah.
quite where it used to be. I probably shouldn't say that if I'm a surgeon, huh? All right, everybody, have a great day. Thank you for spending your time with us, and go have a great day.
Thanks for hosting, John. Nice to see you, Kelly. Take care.
Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.